Hi, my name is Kaya Hines and I'm the CAPC Senior Representative here at the School of Pharmacy. We're getting ready to celebrate Pharmacist Awareness Month, and today we're going to talk to university students to see how much they know about the profession of pharmacy. Okay, Jason, so can you list 2 things that a pharmacist can do?
Yeah, sure. So 2 things. So one of the things is they would educate a patient picking up a prescription, and another thing that's recently been done is the fact that they can vaccinate, so people can come in for flu shots and anything else.
They checked prescriptions, make sure everything's correct. They looked at the amount of prescription that the person needs. Working personally in a pharmacy, I know that the pharmacists make sure the customer feels comfortable with the prescription, and if they have any changes, they were able to help them out with it.
I have a true or false question for you now. True or false? A pharmacist can prescribe a medication to treat a cold sore.
Yes. Yes, they can.
Yep. So pharmacists can prescribe for actually 29 different minor ailments. So that includes things like cold sores, smoking cessation, heartburn, yeast infections. So they can prescribe for a lot of minor ailments. So my question for you, do you know what naloxone is?
Oh, no idea. No idea.
So naloxone is a medication that can be administered to reverse the effects of an opioid overdose. So from things like fentanyl or morphine. Yeah, do you know where one could get a naloxone kit if they thought they needed one?
The pharmacy?
Yes! So you can go to your community pharmacy, you don't need a prescription, and you can tell your pharmacist, I think I need a naloxone kit, and then they can order one in for you, they can instruct you on how to use it, and counsel you on the medication.
Wow.
Yeah.
That's awesome.
So the history of pharmacy education in this province has changed over the past number of years. It used to focus much more on dispensing, but now it has much more of a patient care focus. So here at the School of Pharmacy, we are committed to ensuring that our students are prepared to practice to their full and expanded scope. So we've modified our curriculum so that the students are exposed to injections training, prescribing for minor ailments, another collaborative practice. So they're really prepared to practice in this ever-changing environment.
Well, I think the day-to-day tasks of a pharmacy is definitely different depending on the pharmacy you work in. We engage in a lot of counseling sessions for our patients. And these counseling sessions are mainly to ensure that education is provided to our patients about their new prescriptions. And this includes things such as discussing adherence issues or talking about important administration points, as well as providing them with information about adverse effects that they may experience and different strategies to prevent or manage them.
So in my clinical role, a typical day starts with patient assessment. It's vital that I review not only the patient's medication, but the lab data, the microbiology, the radiology, and assess the patient themselves for their progress so I can prepare for multidisciplinary rounds. In daily patient rounds, I collaborate closely with physicians, nurses, and other healthcare professionals to ensure the most appropriate care is provided to patients.
This past summer, I had a hospital placement that I really enjoyed. I got to see the role of a pharmacist in oncology, ICU, dialysis unit, cardiac care, healthy aging. It was a really good experience.
Pharmacists doing more for you.